Well, we all want to age gracefully, but are we making the right lifestyle choices to help keep our mind and body sharp? Dr. Larry Emdur with Alvarado Hospital joining us this morning. Talk about a unique program. It's called Healthy Aging. Thanks for being with us.
That's my pleasure.
Now, you say that healthy aging is defined by two things, our genotype and our phenotype. Explain, what do you mean by that?
Well, the genotype is our genetic makeup. And the phenotype is how that genetic makeup interacts with the environment. And the choices we make will define whether we develop any diseases or how long we're going to live. And that kind of ties in with what Tiger was talking about in the last segment, is that it looks like the healthiest lifestyle involves one where is a diet which is plant-based. You know, like our mothers and grandmothers used to say, you know, eat your vegetables, eat your fruits. Well, they actually have a lot of antioxidants in it and other chemicals that prevent disease and help us live longer.
So we can't control our gene pool, but we can control what we put in our body, the toxins, the antioxidants, as you were saying.
Well, unfortunately, the American diet is very high on saturated fats, eggs, butter, cheese, meat, and this is actually pro-inflammatory. It probably leads to disease down the line. That's not to say that, you know, you can't eat meat. You should probably be eating less of it. And an excellent diet to follow is a Mediterranean diet, which is high on monounsaturated fats that they get from olive oil or canola oil. They also eat a lot of fats that have omega-3 fatty acids, which are extremely healthy and anti-inflammatory. So if you choose more of a Mediterranean diet and eat meat, let's say, twice a week instead of every day, you're going to be healthier.
So less meat, beef and chicken and maybe the non-fat milks and cheeses?
You know, everybody's concerned about you know, a low-fat diet or a low-carbohydrate diet. The fats and the carbohydrates are fine. It's the form that you take them in. You don't want saturated fats, you want unsaturated fats. And you get that in the fish, you get that in your olive oil. You get the saturated fats if you're using obviously a lot of butter. So by number one, changing your diet. Number two, the biggest point is exercise. You know, everybody says, well, I'm going to exercise. Well, it turns out that exercise is so important. It will help improve your memory. It helps burn fat. It helps lower your cortisol levels, which contribute to diabetes and you know, getting that fat around your midsection. So by being proactive with your diet, with exercise, you can actually prevent disease and live a longer, healthier life.
So when people come in for the Healthy Aging program, how do you target specifically and evaluate what they need?
Well, everybody initially needs the right lifestyle. So we get them on the right diet, we get them exercising, number one. Number two, we'll do a nutritional assessment, which is a blood test to tell us if they have been eating correctly. Thirdly, we start looking at things like their hormonal balance, neurotransmitters, and maybe detoxification. It's a prolonged process, but the whole thing really starts with a lifestyle change, which doesn't cost a lot of money. It's just about making the right choices.
So with that lifestyle change and getting on the right program, you can help prevent, or at least try and prevent, chronic diseases, right?
Well, I mean, you will lower your blood pressure, you will lose weight, you'll prevent arthritis, you will prevent cancer because you're taking all these antioxidants in your food. And that's really why we feel that people that are on the Mediterranean diet are living longer and living healthier because of their choices.
Who's the ideal candidate for your program? What age group are we talking about?
Probably 45 and up. By taking steps now in your 40s and 50s, you can prevent having issues in your 60s and 70s.
What about the costs?
The costs, you know, initial costs are minimal because it's the cost is, you know, your food and exercise, which costs nothing. If you want to get more involved with balancing your hormones, looking at your nutritional status, I do that on a cash basis because we spend a lot of time with the patient, you know, an hour to 2 hours.
So not necessarily covered by insurance, partially covered by insurance?
It's partially covered by insurance. A lot of the lab tests will be covered by the insurance, but the consultation is kind of individualized to the patient. It takes a lot of time. So
how quickly, if someone comes in, signs up for the Unique Aging Program, how quickly can they see a difference?
Well, probably within a month, because all my patients lose like 5 pounds within the first month. within the second month, they're usually feeling phenomenal. I mean, personally, I'm 61. Actually, I'll be 61 in May. I just came back from Colorado skiing with my 30-year-old son at 13,000 feet. And to be able to do that...
Did you beat him down the mountain?
I didn't beat him down the mountain, but I didn't kill myself coming down the mountain.
And that's the key.
That's the key, and I was in good shape, and I felt good. And to be able to do that at age 60 is based on controlling my weight, controlling my blood pressure, staying in shape with exercise before I went on vacation. And a lot of the baby boomers like myself, we want to be able to live vigorously as we age, and that's what this program is all about.
The lifestyle change for a lot of people has to be the toughest. Do you find that most of your patients are able to stick with it and actually become a lot healthier and I wouldn't say disease-free, because when you get up there in age, you're going to have some chronic problems, but do you find that most people are able to stick with it?
Once they're losing weight, once they're thinking sharper like they were in their 20s and 30s, it's an easy sell. They love it.
All right. Dr. Larry Emdur with Alvarado Hospital. It's a great program, Healthy Aging. Thank you so much for coming in and talking about it. All right. And for more information, you can go to Alvarado Hospital or call their phone number, go to their website, alvaradohospital.com, or 1-800-ALVARADO, or just go to our website, san diego6.com.